Good morning, Excellencies, ladies and gentlemen. It is with great pleasure that I welcome you to the live forum for candidates for the nomination of the next WHO Regional Director for Africa. First of all, let me apologize for Dr. Dikoloti, who is the substantive chair of the WHO Africa, who had pressing matter that he's attending to, but will join us as soon as he is available. I would like to acknowledge the Regional Director, Dr. Moeti's presence with us today, connecting remotely from Brazzaville. Welcome, Dr. Moeti.
Thank you. Thank you very much, Madam Permanent Secretary, representing the Minister. I'd like to greet you and greet through you the Honorable Minister when he arrives. Greet all the Honorable Ministers who have joined this very important meeting. Greet the representatives as well. And of course, a warm greeting to the candidates who are joining today. Thank you very much, and I'm looking forward to a very important discussion in this important step for the election. Thank you.
Thank you. This live forum for candidates has been convened at the instance of the chair of the 73rd Regional Committee, in line with the recent practice followed in other regions of the WHO. In the absence of any objections to the proposal to hold a live forum, as circulated through the note verbal dated 14th of May, it was considered and agreed to proceed with the practical arrangement of the live forum. Let me thank you all for the support given to this initiative and to the Secretariat for its readiness in organizing it. As you know, this is a non-decision-making platform intended to provide an opportunity for candidates to present their experience, their expertise, and vision to enable member states to acquaint themselves with a candidate. Participation in the forum for candidates is limited to member states of the WHO African region, assisted by a limited number of Secretariat staff. Please note that this forum for candidates has interpretation in English, French, and Portuguese, and is being webcast for public viewing on the regional office website, as well as live streamed on social media accounts, YouTube, Facebook, and Twitter. In view of the above, may I please request that you speak at a moderate pace to the convenience of the interpreters. We kindly ask all those in the room to have their phones off in order not to disrupt the conduct of this live forum. Allow me now to turn to the arrangement for the interviews. With the communication of the Secretariat on the 28th of June 2024, the Secretariat circulated the arrangement for this meeting. Each candidate is to make a presentation of up to 20 minutes, which will be followed by a question and answer session for an overall duration of up to 40 minutes. May I recall that the detailed proposed arrangement for the interview are as follows. Turning first to the initial oral presentation. The oral presentation by each candidate is not to exceed 20 minutes. While 20 minutes is allotted for the presentation, candidates may wish to make a presentation of less than 20 minutes in order to leave more time for questions and answers. As far as the process of selecting questions is concerned, each member state joining the forum may ask questions if it so wishes. Member states were invited to indicate the candidates they wished to ask a question by writing to the regional office no later than 15th of July at 1700 hours, Brazzaville time. Tokens bearing the names of all the member states which notified the Secretariat that they wish to ask questions were put into the relevant receptacles, one for each candidate. Let me remind you also that member states that propose a candidate are expected to refrain from asking the candidate a question. After each candidate has made their oral presentation, I'll pull the token one by one on a random basis until the time available is exhausted. After each token is drawn, the corresponding member states will be invited to ask their question and the candidate invited to provide an answer. As concerns the procedure for the question and answer session, member states will have up to 1 minute to ask the question only. Please do not divide questions into different parts, such that there is, in effect, more than one question. I would ask the member states whose lots have been drawn and are therefore provided the opportunity to ask a question, kindly to refrain from posing a question to a candidate which seems identical or substantially similar to one already addressed to that candidate. I would also ask member states to please have their camera on and to unmute when given the floor. Candidates have up to 3 minutes to respond to each question. Each interview will conclude when 40 minutes have elapsed, even if there are still questions pending. However, a candidate will be permitted to complete their answer to the question being addressed when the 40 minutes have elapsed. Should there still be time available after all tokens have been drawn, I will open the floor to the member states that have not yet asked a question to see whether they wish to do so. I will give the floor to member states in order in which they raise their hands in Zoom. If following this, there is still time available, the candidate may, if they wish, make additional remarks within the remaining time. Member states connected online and those of us in the room will see a clock on the screen indicating how much of the 40 minutes allocated per interview remains. There will also be a clock indicating how much of the 3 minutes time limit for responding to each question remains. This will be used to help participants to keep within the time limits. Because of the strict time limits, I will ask member states not to interrupt the interview process by taking the floor unless this is on a matter dealing with the conduct of the interview itself. Please note that in my capacity as moderator of this forum, I may ask you to conclude your question or intervention in case it goes beyond the allotted time. Are there any questions? Please raise your hand, indicate by raising your hand if you have questions. There seems to be a hand up. Please, can you identify who you are? Okay. There seems to be one hand. Can you please identify who you are and ask your question? I understand Tanzania, your hand is up. Can you please ask your question?
Yeah, sorry, I think it was by accident. It was not meant to be raised. Sorry.
Thank you. Thank you very much. So we see no hands up, so we shall proceed. I therefore take it that there is agreement to follow the proposed modalities as already explained. Now, in line with the note bevel of 28th of June, I propose that the forum continue
Muito
until
bem, em
1400
conformidade então
hours
com o
Brazilian time.
processo, a nota verbal que foi enviada no dia 28 de junho, proponho que o fórum continue até às 14 horas, hora de Brazzaville, com um pequeno intervalo de meia hora e na sequência de 2 entrevistas.
Is there an agreement to the
Durante
proposed-
esse intervalo, pedimos que permaneçam ligados. Será que estão de acordo com o que eu acabo de propor?
Anything contrary, you can please indicate by
Se
raising your
tiver contra, por favor, levante.
no objection. So we shall proceed. Before proceeding to determine the order of interviews, let me remind you of the following publications of the nominations. Côte d'Ivoire informed the Director General of the withdrawal of his proposal. We now need to decide in what order the interviews will be held by drawing lots for the 4 remaining candidates. The order of the interviews will be based in the order in which the names are drawn. I will now proceed to draw the names with the help of the Secretariat. So the first candidate will be Dr. Borema Hama Sambo. And the second candidate will be the third candidate will be Dr. Faustine Engelbert Ndugulile. And therefore, the last candidate is Dr. Richard Migo. I now kindly ask Dr. Borema Hamasambo to prepare to take the floor. Remember to switch on your camera and your microphone.
Thank you,
I-
Madam.
Okay, so
Can I
we will
start?
now. Thank you, Dr. Borema Hamasambo, for joining this forum today. May I now ask the Secretary to ensure that Dr. Borema Hamasambo is ready to take the floor. Please proceed with your oral presentation for up to 20 minutes. Thank you.
Thank you, Madam Moderator. Honorable Permanent Secretary of the Ministry of Health of Botswana, representing the Honorable Edwin Dikoloti, Minister of Health of Botswana and current chair of the WHO Regional Committee for Africa, Honorable Ministers of Health and distinguished delegates from member states, Dr. Matshidiso Moeti, WHO Regional Director for Africa, esteemed colleagues, dear friends, ladies and gentlemen, good morning, bon dia, bonjour. Honorable Moderator, I will continue from the French. Yes, je suis très honoré par la nomination.
I am
de mon pays.
deeply honored to have been nominated by my country, Republic of Niger, as candidate for Regional Director of WHO for Africa. It is a great privilege to represent my nation. It is also an honor for me to address you today, and I thank you for giving consideration to my candidature. We appreciate this process, and I cherish this opportunity to make a presentation. I am deeply appreciative of the warm reception I have received at the virtual meetings in the last few weeks. You have my vision and priorities, and I pledge to implement them if elected as regional director. Today, before you, I would like to emphasize 3 points. Number one, we need to acknowledge the remarkable progress of the African transformation agenda in the last 10 years, thanks to the various guidelines under the leadership of Dr. Moeti. We have seen great improvement in the health sector, reduction of the burden of morbidity, etc. The Universal Health Coverage Index has doubled in the region from 23 to 46. Maternal mortality has reduced to 531 in 2020. In addition, all the 47 offices in the region have completed the functional review, and all staff have been trained to prevention of and response to sexual exploitation. These achievements and the results are a solid basis to deepen the action of WHO. Secondly, the 14th General Program of Work approved during the 73rd session, proposed at the 67th section, has proposed robust actions. And this gives us a global vision to ensure and protect the health of everybody. This objective is in line with the priorities that I identified myself. Thirdly, whilst celebrating our successes, we must acknowledge that there are programs that still need to be carried out. For example, our region continues to bear the burden of the highest number of non-communicable diseases. We also had an increase in the death of under 5 children, whereas we recorded a 30% increase in live births. Our region also continues to bear the greatest burden of HIV morbidity, and we're also seeing an increase in the morbidity of communicable diseases and trauma, as well as an increase in the burden of climate change and its impact on the populations. In order to address these objectives, allow me to measure some of the roles. I have spent more than 35 years in public health, and I have been representative of the WHO and the DRC, and I have covered capacity building at local level and efforts based on primary health, and I prioritized leadership in humanitarian action, deepening of partnerships as well. I've also been director of climate in Geneva, and there I was able to ensure progress in the WHO program on climate and health. I started my professional career as a district doctor. I was a field doctor in my country. In this capacity, I carried out leadership roles. For several years, I acquired solid experience in leading diverse teams and managing complex programs, and I operated in political and complex milieu to achieve these objectives. I have headed several WHO offices in the region and worked exhaustively in the Africa region. I have covered all areas of the health sector and WHO, so I have a very good understanding of the challenges facing the region. Outbreaks of infectious diseases, limitation of health sectors. I have vast experience, and I am passionate about fighting the lack of disparity in the health sector. My vision for our region is simple but ambitious. A vision of a healthy African region that is prosperous and safe for everyone, everywhere. Today, I would like to use my 5 priorities for the 5 key areas to help the region implement the 14th General Program of Work, as well as Agenda 2063 of the African Union. I would like to start by sharing with you that we need a renewed vision for our region. The region stands at a critical junction. Even though we have had significant progress with a greater number of people living longer and healthier, our health and our health systems are still confronted with a diffuse set of challenges that have been exacerbated by the recent polio crisis, climate-related issues, COVID-19 pandemic, and mounting conflict. And yet, we have the youngest population, and we're the fastest growing in the world. So if we use our pooled and natural resources as well as our human capital, we can stimulate sustainable growth. Our ministers of health have the possibility of contributing to the health of our countries and the full potential by improving health and well-being of its populations. I am convinced, in pursuit of this vision, that the WHO can contribute to achieving sustainable progress by deepening partnerships, strengthening the systems in order to have sustainable progress towards the African Health Strategy of 2016 to 2030, the SDPs, and my priorities will therefore be to provide intensified support on 5 key areas with gender and equality at its heart. My first priority would be to address the main drivers of the disease burden. 55% of deaths in our region is due to communicable diseases. Non-communicable accounted for 35%. The projection is that non-communicable diseases will account for 50% of deaths by 2025. We also have an increase in trauma diseases, mental health, and nutritional challenges, in addition to communicable and non-communicable diseases. This disease leads to a reduction in productivity every year. But fortunately, most of this can be prevented. If elected regional director, I will leverage on my experience to come up with achievements and contribute to strengthen health systems at national and local levels to ensure equitable access to integrated packages of proven cost-effective health interventions for all ages. This will mean intensification of provision of innovations such as the malaria vaccine. My second vision will be to improve the quality of life and promote healthier living. The burden of the high disease burden, as well as emergencies and disasters, add pressure to the fragile health systems. The high-risk behaviors, such as lack of physical activity, tobacco and harmful alcohol use, and unhealthy diet are on the rise, especially among young Africans. In 2019, we had the highest level of morbidity from poor air quality. So my priority will be to focus on ensuring that the people have a healthier approach. I would use my experience in the prevention of non-communicable diseases and the competencies and leadership to provide innovative solutions for improved health in all sectors of the society. My third priority would be universal access to quality health services. The capacities region to cope with health emergencies is based on a resilient and sustainably financed health system. The region is expected to have a deficit of more than 5 million health workers by 2030. The region has to reverse this trend by using a holistic approach and innovative approach that is gender sensitive and based on equity. I would use my experience to collaborate with the African Union and other partners to share good practices and proven practices on effective health systems that are context-specific. My fourth priority will be to enhance health security and achieve self-reliance. Each year, the region reports more than 100 acute public health events. Many of these emergencies can be prevented through proven interventions. COVID-19 highlighted our vulnerability. In 2022, 60% of the population of the African continent was affected by incidents relating to climate, and we were most affected. We will continue to plead for integrating the One Health approach in order to combat climate change and antimicrobial resistance. On the basis of my experience in disease control and intervention in climate incidents, we will work with this Africa CDC, NEPAD, and other partners to prevent, detect, and respond to the region's wide range of emergencies and ensure the manufacturing of health security products. Fifth, foster partnership for local solutions. Addressing the regional challenges will require strong collaboration across sectors and geographies. So international and governmental organizations, academia, civil society, and the youth and the private sector will all have a crucial role to play. Promoting African solutions to African problems will require strong South-South cooperation that is supported by local research initiatives. Building on my solid interpersonal capacity will enable us strengthen our partnership with the African Union and other partners to coordinate regional initiatives. There will be need for innovation and more solid alliances and technology to operationalize my vision. I will concentrate on the following. One, advocacy and policy support. Two, improve health systems resilience. Three, ensure progress in the resilience of the health systems. Four, take advantage of innovation and digital transformation. Five, engage people in their own health. And six, leverage strategic partnerships. I have included the details of each of these strategies in my vision statement. Honorable Chairman, ladies and gentlemen, I am candidate for this position because I believe in the power of this organization to have a positive impact on the countries of our continent. To achieve this, the WHO needs to be agile in organization, enjoy flexible and predictable funding, and all this should be based on the principles of transparency and accountability, optimal utilization of financial and human resources, use of digital transformation, equitable distribution, and open communication. We are halfway through the Sustainable Development Program by 2030. It is time for the WHO to take center stage in terms of health, accept change, and deepen regional cooperation. Together, we can ensure a better future for all the inhabitants of our region. Thank you once again for this opportunity.
Thank you, Dr. Burema Hamasambo. We will now continue the interview with questions and answers. I'll now pull the first token with the name of a member state which expressed the wish to ask a question to Dr. Burema Hamasambo. So the first member to ask is Togo. I will now ask the member Togo to please ask the question. Please, Togo, unmute and you can put on your video as well, your camera.
Merci
Togo?
beaucoup, Madame la Présidente.
Thank you, Madam Chair.
Je voudrais remercier le docteur
I would like to thank Dr. Burema Hamasambo for
son programme. Cher Dr.
presenting
Burema
his program.
Hamasambo, pourriez-vous
Dr. Burema Hamasambo,
partager avec nous
could you share with
des
us
actions innovantes
the innovative
en matière de santé
actions
dans la région
in
africaine
the
de l'Ouest
area of
pour
health
garantir des
in
résultats
the Africa
concrets
region
au
to
cours de votre
ensure concrete results during your tenure?
Thank you, Togo. Dr.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Moderator.
Thank you. Dr. Burema Hamasambo, you may now have the floor to answer the question within 3 minutes, please.
Thank you, Madame Moderator. Merci, Honorable.
Thank you,
délégué du Togo.
distinguished delegate of Togo. I agree with you as indicated in my presentation. Innovative solutions are what we need in our region for several reasons. The low level of health coverage, and as well as the capacity at central level. There are many things we can do to use innovation. In the region, we have used approaches like telemedicine, but now with telephony and Androids, we have used it, we have tested it with some programs that we had. We used it, for instance, to screen communicable diseases. This has been used from the most remote areas because a nurse can do a test to detect cervical cancer and send the results to the center. Beyond this, innovation is making progress with artificial intelligence. There are many areas where we can transform our weaknesses into strength. For example, if you are a radiologist or surgeon or gynecologist in one location, you can serve a wide range of people, availing yourself of the means, the technological means that we have now. And we can also provide training by means of the internet to build capacity. The third aspect is that we know that our region has a problem in the area of data. And we know that with innovative approaches, internet and all the other technological advancements that I mentioned, the use of tablets, we can improve a lot here. For example, with polio, we use tablets to monitor the vaccinators. All of this contribute to improving the quality of care, and they prove that innovation would be a solution to our problems. Thank you.
Thank you. Thank you very much, Dr. Sambo. The next member state to ask the question is Senegal. Please, Senegal, you may unmute and ask your question.
Merci beaucoup. Donc, c'est Dr. Ibrahim
Thank you.
ministre de la Santé.
Dr. Ibrahim Sy here, Ministry of Health of Senegal. Thank you, Dr. Bourayma Hama Sambo.
Juste une question.
I have a question for you. Can you give us concrete examples of reforms that you participated in at global or regional level that have an impact on public health? Did you play a leadership role in these reforms? Thank you. Thank you, Honorable Minister. I was at the regional office when this reform started, and I was at the Gabon office where I represented the WHO and also led the inter-country team. We had country offices, 3 inter-country offices, 1 in Gabon for Central Africa, 1 in Ouagadougou for West Africa, and 1 for East and Southern Africa in Harare. We strengthened the teams. With this ISTs, we strengthened the regional office. So in terms of resources that the ISTs needed, because the ISTs are like branches of the regional offices, of the regional office. So we worked with the regional offices to identify the resources we needed. The idea was to bring the technical expertise of WHO to the countries and see what works best for them. So we carried out the process and we were therefore able to improve the outcomes. In Gabon, I headed the WHO reform there. It was not only in the area of human resources, it was also in terms of the functional approach, the agility of the WHO, which was programmatic, also in terms of human resources and program management. So the Gabon office, well, Gabon is not a very big country, but in Ethiopia, I was able to start and complete the WHO reform in Ethiopia. We did it in the spirit of total transparency. We had the functional review that came to see the realities of the country, its size, and what is needed for the country to have the required resources to function. And we were able to do this in spite of the size and complexity of the country to ensure that we were able to put the structure in place in the office and in all the 14 regions of Ethiopia. We did this successfully. Thank you, Honorable Minister.
Thank you, Dr. Sambo. And the next member state will be Guinea. Guinea, please, can you unmute and ask your question? We don't seem to have Guinea online, so we're going to get to the next member state, which is South Sudan.
Thank you very much for giving South Sudan the floor. And thank you, Dr. Borema, for the presentation. You mentioned that one of your priorities is to look at the disease burden and including communicable diseases. And you mentioned also use of vaccines like malaria vaccine. My question is, many countries have already introduced malaria vaccine in Africa, and my country has done that last week, but there is infodemics on malaria vaccine, the R21. How do you plan to address the issue of infodemics against health interventions like malaria vaccines and other vaccines, as well as other medical countermeasures? Thank you.
Thank you, Honorable Delegate from South Sudan. In fact, yes, you are right. We are neighbors because I'm right now in the Democratic Republic of the Congo, where also infodemics has really played a very negative role in many issues, including, as you know, the polio vaccine we are fighting against, even Ebola, because we are trying to have ring vaccination for those who have been in contact. The infodemics has also played a negative role in many countries where malaria vaccine was introduced, including Cameroon, where they had actually to postpone the launch of this one. What we did and what we can work is to do an upstream work. What I mean by upstream work, I really mentioned during my presentation, working with communities. We need to inform, to discuss, and really to inform and re-inform, and use health promotion processes to inform our communities and our local leaders. When I say our local leaders, it can be those in the government, faith-based leaders, and even traditional leaders, because in their communities, they are community leaders, to inform them about the safety and the importance of vaccination. It's not only malaria, Honorable Delegates, it's also all other vaccine preventable diseases, especially when we have issues, when we have, when the adverse effect of vaccines happen. Many of our people use this to say that these vaccines have a problem, but we know there is no better way to prevent than to vaccinate for all vaccine preventable diseases when we have vaccine. So I think we need to do an upstream work, working with communities, local leaders, to sensitize and to gain their confidence. And what we say, a community that knows that this is for the good of their community, they will support us as health leaders. So, and I think we have been successful in implementing many of those in your neighbor country, that is in TRC. and we have all it done now. So what I can say, besides communication, we need just to make sure that we give the right answers or the right information about the vaccine to our communities and our population. Thank you, Honorable Minister.
Thank you. The next member state will be Seychelles. Seychelles,
Je
you
vous
have the-
remercie, Madame la Présidente.
Thank you,
Est-ce que vous m'entendez?
Madam Chair. Can you hear me?
Yes, please go ahead. We can hear you.
Je vous remercie.
Thank you.
Monsieur Sambo, Dr. Sambo.
Dr.
merci de votre
Sambo,
présentation. Ma
thank
question est
you
la
for
suivante.
your presentation. Here's my
Les Seychelles
question.
sont l'un des petits États
Seychelles
insulaires
is
d'Afrique.
one of the small island developing countries
Je
of
voudrais vous
Africa.
demander, s'il vous
I would
plaît,
like to
est-ce que
ask
vous
you
savez quels sont les autres petits États
if
insulaires
you know the
dans le nord
other
de l'Afrique?
small island
Quels sont les
developing countries
problèmes
in Africa,
sanitaires
and what are the
auxquels
health
ils sont confrontés
problems
actuellement, ces petits États
facing these
insulaires? Merci.
small island developing countries at the moment? Thank you. Thank you, Honorable Minister, for giving me this opportunity. Because when I was in the regional office, these were the countries that I visited the most. I'm a specialist of non-communicable diseases, and I'm particularly familiar with them in Seychelles. The other states in our region, you have Seychelles, where yours, Mauritius, Comoros, Sao Tome and Principe, and Cabo Verde. Madagascar is an island continent. So these are the small island developing states, and that are the ones that have the heavier burden of non-communicable diseases. Indeed, it was in Mauritius that we organized the first international meeting on cardiovascular diseases, diabetes, and NCDs. I was one of the first to do the survey in your country, and so you have the 5 states that I mentioned.
Les États sont communs par le profil épidémiologique qu'ils ont, qui aide ce que je dis
But
d'abord.
also, the epidemiological profile fosters the NCDs. There is also the problem of provision of procurement of medicines. And this is why we initiated pool procurement for states so that they can come together and constitute a force. The third reality is the impact of climate change. Because they are small countries, islands surrounded by water, the impact of climate change is very strong in these countries. In my presentation, I mentioned climate resilience and what we can do to mitigate the effects of climate change on our peoples. Honorable Minister, this is what I would like to say. I am very familiar with the region. In the Africa region, it's one region that I know very well. Thank you for your familiarity with this matter. Thank you.
Okay, the next question will come from Mauritania. Mauritania, you now have the floor.
Bonjour, monsieur. Oui, bonjour.
Good morning.
Est-ce que vous m'entendez?
Can you hear me?
We can hear you clearly.
Voilà, j'ai suivi avec attention votre
I
exposé.
listened attentively to your presentation, Dr. Brahima. We know that Africa is a continent that has the most health crises. So what experience do you have in managing major health crisis affecting several countries at the same time in the region? Thank you, distinguished delegate of Mauritania. Yes, in my presentation, I said that I managed a lot of grade 3 crises. First in Ethiopia, where I managed 3 grade 3 crises on account of the conflict in the north of the country, which covered all the states that had Tigray, borders with Tigray that was at conflict with the center. So the other states that affected Amara and Afar. Then the second crisis that I managed there involved in other countries, and that is drought, because there was drought in the Horn of Africa. So Ethiopia, Somalia, South Sudan, and parts of Kenya, Djibouti, and Eritrea were affected. We coordinated this with the WHO country offices in other countries and the ministries of health. Once there was a grade 3 emergency, you know, it is something that the WHO manages at these 3 levels, at country level, at the regional office, and at headquarters. With all this crisis, incident managers were designated, and there was coordination with the WHO representative in the host country, Ethiopia, in my case. So I had an incident manager in Mekelle in Ethiopia and in Somalia. Also in DRC, we had a grade 3 emergency, because in the northeast of the country, where there was a system in place with the conflicts and a massive number of IDPs and refugees, and the situation became a problem of a grade 3 health emergency, and I managed this. The WHO is very happy about this because beyond the 3 provinces, the WHO kept an eye on all the provinces in the country and was able to contain them in 6. The result of the evaluation done shows that this initiative was very successful. Thank you.
Thank you, Dr. Sambo. It looks like the total time for the interview has now been exhausted, and we want to thank you very much and wish you well. Thank you for coming today, Dr. Sambo.
Thank you, Madam. It was a pleasure. Thank you.
Thank you. So the next candidate will be Dr. Ibrahima Sose Fall. Or Fall. My apologies. So, Dr. Fall, you can now make your presentation. Thank you.
Good morning, Madam Chair. Can you hear me?
We can hear you clearly, Dr. Fall.
Merci beaucoup. Mesdames et Messieurs, honorables ministres, chers
very much, ladies and gentlemen, distinguished ministers, representatives of member states, dear colleagues and partners. It's an honor and indeed a pleasure for me to be here today as a candidate and to speak to you about my vision for WHO. Let me begin by thanking all the who are coming forward, and this is very good for Africa. But I'd like to also salute Dr. Moiti. It's an honor for us. May I start by speaking briefly about myself, tell you a little bit about my past, then explain my reasons, which is, and then I'll put a focus on my vision for African health systems, emergency risks, and what needs to be done. So my name is Dr. Ibrahima Sosé Fall. I'm from Senegal, but I consider myself an African because I don't just come from one country. I had thought initially that I should be a doctor and thus be useful to society. My passion as I grew up was to become a doctor. Solidarity, respect, humanism, all these were motivations for my choice. And at school I was good and was able to get into the military competitive process. And this, in fact, had been put in place by President Senghor. And we were able to strengthen health systems everywhere. And I think this is what motivated my work, service to humanity. And since we were told the army must serve the population, this meant not just was I a doctor, but I also had these skills that you have in the military, the values, the skills that. So my brother and comrade, Captain Badja, who was a hero for the values I'm speaking to you about. In fact, thousands of people were saved by him. Youth in Rwanda, in Senegal, everywhere in the world, because in fact, the United Nations conferred a medal on him, and I was with him, alongside him. So you see, these were the examples I had. Devotion, humanity, all these were my skills.
In the forest area of Senegal, where we had a conflict, and it was right after my first doctoral dissertation in 1992. And I spent 2 years in Casamance, spending nights in pantries, but also dedicating a lot of time in the community, because at that time, all the health workers left the place because of insecurity. So with my small team, I was able to organize the primary healthcare intervention, including vaccination, doing antenatal care, but also delivering babies in a very risky condition. So the discipline and structure of the military provided a solid foundation for my approach to public health. I learned the importance of meticulous planning, quick decision-making, and the ability to adapt to a rapidly changing situation and environment. So this background instilled in me a strong sense of duty, relentless of commitment to achieving our goals, no matter the obstacles. I'm a problem solver. And so I was then seconded to the Minister of Health in a very difficult region and in Senegal, and managing both a district, but also all endemic and epidemic disease for a region, including immunization. And during that time, I had to lead Senegal's response to the biggest meningitis outbreak in the Sahel in 1996, where the Sahel region recorded more than 30,000 deaths. And the issue of vaccine availability was already a big problem. And with my team in Senegal, we were able to imagine a ring vaccination strategy, protecting the northeast border of Senegal, and then protect Senegal. And Senegal was saved from that vaccine. And already working at district level, I started challenging the data at national level, because I'm a believer of evidence-based approach for public health and community-based intervention. And during that time, we were able to eliminate Guinea-worm transmission in 1998 using evidence-based approach and community engagement. So working closely with diverse communities allowed me to see the profound impact of health services on people's lives. I realized that true public health goes beyond treating diseases. It's about understanding the social determinant of health and addressing the broader factors that contribute to well-being. The early experiences fueled my passion for public health and solidified my commitment to making a difference in Africa. They reinforced my belief that effective health intervention must be community-centered, culturally sensitive and inclusive, ensuring that no one is left behind. And my first contact with WHO was really in 1996. But before that, being able to work in most challenging environment and resource-limited environment was really an experience that honed my ability to remain calm and decisive under pressure. And this is an essential quality for effective leadership in public health. And with all that background, my 5 core values are about humility, humanity, integrity, discipline, and courage. And additionally, I'm a strong believer of teamwork and respectful workplace. And I was saying my first contact with WHO was in 96 when I attended the international training course on malaria, and I was the best student. That's why WHO started, using me as international consultant to start the introduction of rollback malaria. And I joined later on as malaria intercountry teams coordinator for the African region. And as you can see, I've worked also as WHO representative, regional emergency director, assistant director general, and now director of the Global NTD program. And so my motivation for this job is very clear. And I will shift to French at this stage as, we are all multilingual. And I hope by, few years I will be able to do it also in Portuguese. Ma motivation est surtout liée à mon amour pour l'Afrique.
My motivation is essentially linked to my love for Africa. It is high time Africa aimed very high and looked at sustainable health goals.
I think somebody's making noise.
Despite the difficulties our region faces,
le Bénin est en train de parler.
Le Bénin, s'il vous plaît. C'est le docteur Moiti.
Donc, malgré les défis auxquels la région est confrontée, l'Afrique bénéficie également
so despite the challenges our region faces, Africa has several opportunities, multiple opportunities because of our youth, our economic potential, and we have to seize this potential to ensure health for all and health in all places. Health is an essential motivator for development. And my priority when I was in post was to ensure that we reach global health standards. But back in Africa, my aim was to support the continent, assist our continent, improve on our health systems, with health actually playing a primary role. It is indeed important. Africa ensures not just leadership at the WHO level, but also stewarding the health systems, propelling them forward, seizing all the development opportunities on the basis of the expertise and experience and the skills, the sound skills that we possess. I was saying earlier, let me mention what distinguishes me from other candidates. First of all, leadership at the regional and the global level. When I talk about leadership, this is proven in my case because of the role that I've played in organizing, changing, ensuring improved impact for our population. In fact, I'm the only candidate who is in the regional executive management team for emergencies, and I'm the only candidate who was one of the executive management team at a global level. I was a deputy director, regional deputy director responsible for emergencies. I also led many initiatives that transformed disease control in the region. First of all, fighting malaria, where I introduced the strategy planning emergency-based work to ensure impact. And I also looked at worked on the global reforms. And I led emergency teams, Dr. Moiti's transformation agenda. I led the health security pillar. And the first results that we achieved, that Dr. Sambo mentioned, that Dr. Mwendo had achieved in health security, was also part of the work that I did, because I worked on emergency-based preparedness. I looked at epidemics in Africa going back over 50 years, and also looked at an external evaluation of our regional realities, so that this will lead to better when it transformation at the global level. As the assistant deputy director, I worked on emergencies, that setting up new, and of course I led emergency transformation process with the focus on governance. Another point that differentiates me from the other colleagues is that in 1999, in 2019, I was in the task force that was able to deliver biomedical equipment in over 100 countries. And this meant that we were doing better biomedical imaging globally. And through partnerships, I was able to set up global strategies, be part of the global strategies that enabled us to eliminate epidemics, cholera, meningitis, etc. And there was an ICG group, as it was called, which I led, coordinating vaccinations distributed against the epidemics at the time. With regard to strategic planning force, and there were results in the health cluster where there were over 900 partners. I was able to also work on other areas of difference, and I'll go into them in more detail if I am asked. But really, I'm the only candidate who is able to sit these countries as a leader and at the global level. I'm the only one in WHO who twice was appointed by two different UN Secretary Generals and two different directors, regional directors, to manage emergencies, including the crisis in the Congo. Talking also about other factors that distinguish me from the others, I am able to coordinate in very diverse manners. I've been able to manage crises in development programs for cross-cutting, addressing cross-cutting issues. Another thing is the health workforce. In Africa, and I have been able not only to work with directors in the various emergency programs, but also with other leaders. My vision is health for all and all for health. In Africa, that is more prosperous, more sovereign, and this is I have worked on the basis of a health systems, and also strengthen them towards greater prosperity. I would like to say I have worked with Africa CDC, the African Union, and all the sub-regional blocks. It's obvious when it comes to disease control, against malaria, against other diseases, well, we've improved our health systems, but we still have problems. And even if we're looking at all these programs, we've had to fight infectious diseases, even just over the past 2 months. So what we really have to do is seize all the opportunities that exist. We have to look at non-communicable diseases. We have at least 7 million, and we have these children who are benefiting from our vaccination programs, and so we also have to work take over, take into consideration
non-communicable diseases,
the
and then urban planning that is not being done well is another challenge. We also need to look at the leadership as well as industrial development, technological developments, research and innovation, and the role of other institutions like Africa CDC. We also need to foster solid partnerships. In terms of health system strengthening, we need to put health at the core of political decisions. We need to avoid fragmenting health governance and ensure that there's adequate and sustainable financing for health. My second priority is with regard to preparedness for health emergencies. So enhanced preparedness, prevention, and response to emergencies. We need to look at enhancing national and sub-national capacities in health security. The third priority would be accelerating the reduction of maternal, newborn, and under 5 mortality, as well as the elimination and eradication of high-impact communicable diseases. My fourth priority would be combating the rise of non-communicable diseases and mental health disorders. The fifth priority would be focused on health intelligence, so that not only do we have good planning, but we can analyze future health risks, particularly those linked to climate change. And of course, this will be done through health emergency leadership. Another special initiative would be looking at marginalized groups and the integrated disease approach and zero vaccine dose children strategy. And lastly, health, technology, and innovation. As you can see, there's a lot to be done in Africa, but we need a credible, diversified WHO that has the ability to assist member states to identify priorities and have more sustainable financing systems. We need to mobilize partners' support in line with the Lusaka agenda. My professional experience and my commitment to health make me an ideal candidate to work with member states. I consider this as a mission. I want to see health playing a role in Africa's development and prosperity. It will also help us have solid partnerships and commitment, because together we can overcome challenges and have a more prosperous Africa. Thank you so much. I'm ready for questions now.
Thank you, Dr. Fall. We will now continue the interview with questions and answers. So I'll pull out the first token with the name of the member who has expressed their wish to ask a question to Dr. Fall. Sorry. The first member is Ethiopia. Ethiopia, may you unmute your mic, please, and ask your question.
Thank you. Thank you very much, Dr. Sophie. It was a pleasure to hear from you and to hear your vision. My question is, what do you envision as a contribution of WHO-AFRO in realization of the Agenda 2063? Because, as you've said, there are many needs and there are many pressing needs in Africa. where you initially more prioritized emergencies and public health emergencies. And while the other agendas like maternal and newborn related issues are also part of the agendas that you say, but we didn't get a chance to hear the details around them. So mainly in the areas where we are lagging behind as a continent in SDG targets, what do you envision the contribution of WHO-AFRO would be in realization of the agenda, the African Agenda 2063? Thank you.
Yes, go ahead, Dr. Fall.
Thank you very much, Honorable Minister. This is a very important question because we have so much to do in Africa, making sure that WHO-AFRO and Africa CDC work together to really implement the Agenda 2063 for impact is crucial. And when I was Regional Emergency Director in AFRO, I already, developed a concept of collaboration between WHO and Africa CDC. But what we are lacking now is really to be able, as WHO, to leverage the political capital of Africa Union and Africa CDC. If you look at most of our strategies are just approved as a regional committee, but there is no link with the continental policies and strategies. We need to use the political space and political capital of Africa Union. So when we have a strategy approved by Minister of Health, it's also reflected, at the African Union and endorsed by head of state. I was saying health is a political capital. So if we make sure that we bridge that gap between the technical work of WHO and the political capital of Africa Union, we'll be able to work together around those special initiatives I talked about, including acceleration of reduction of maternal, newborn, and the 5 mortalities. So, and one of my first priorities is really to look at all the work we are doing with Africa CDC and Africa Union, and to make sure that we empower the WHO Bureau in Addis Ababa to be able to be the interface and to be the bridge between everything we are doing at regional level in Afro and what is happening at the African Union. I think we have the opportunity to reposition Africa within the global health architecture, as I said, with Africa CDC, and this is a firm commitment I'm, expressing today. Thank you.
Thank you, Dr. Fall. And the next member state that will answer the question is Gambia. The Gambia, you may ask your question, please.
Thank you very much, and good morning to you all, Dr. Moeti and the entire team. We thank Dr. Fall for that presentation. We listened keenly, and our question is a simple one. We know the WHO has been doing quite a lot of work over the years, especially under the leadership of Dr. Moeti. So we want an add-on onto the good work he has done. But we realize that countries are not as empowered as some of us would have wanted to. We want to see strengthening of the country offices to be able to deal with country-specific challenges, some of which are capacity gaps. So my question is, what do you intend to do to strengthen the country offices so that they deal with unique country challenges, especially where we have capacity gaps? Many of our countries, we have a lot of challenges when it comes to certain specialties, whether it is clinical specialties, public health specialties, and so on. And it is of great concern to some of us. Thank you.
Thank you very much, Honorable Minister. I wish I could respond to you in Wolof or Sose and our common language, but let me go for English. And this is a very important question because, in WHO in Africa, we have diverse countries in terms of risk, in terms of capacity, in terms of population size and geographic location. And it's very important to tailor WHO support based on those specificities, making sure that we provide support for the right policy, but also for the right strategy plan, implementation plan, for the right funding mechanism, including domestic financing, but also international financing. So it's very important to look at the profile of the staff in WHO country office to make sure that it fits the need of the country we are serving. But at the same time, you have capacity at regional but also sub-regional level with the M4 to be able to provide targeted support, because we will not be able to have a disease specialist for every single disease. But making sure that we have a pool of persons from the regional office or sub-regional office able to provide timely support to countries is extremely important. And this goes from the policy, formulation, strategic planning, implementation plan, and financing, but also in terms of monitoring and evaluation to monitor the quality of the intervention and the impact. So I am committed to make sure that what we are doing is really targeted based on the country specificities. And this applies to small, developing islands, as we heard before, because we need to take into account the specificity of every single country to be able to provide the support needed. Thank you.
Thank you, Dr. Fall. The next member country will be Guinea. Guinea, you have the floor, please. Looks like Guinea is not on. Oh, is that Guinea? Yeah. Okay, go ahead, Guinea.
Okay, yeah, no, okay. Muito bom dia. Obrigada, senhora presidente da sessão. Quero
Okay.
parabenizar a senhora
Sorry,
Moeti.
excuse me. That was Guinea, not Guinea-Bissau.
Okay.
Okay, so we'll look for the next candidate. And the next candidate is, in fact, Guinea-Bissau. So please go ahead. So we can go ahead. Thank you.
Muito bom dia, obrigada, senhora presidente.
Good morning, Madam Moderator. Thank you very much. I'd like to first of all congratulate Dr. Moeti for excellent leadership of the WHO-AFRO. My question is as follows. What are the public health emergencies in African countries, more specifically the Sahel countries, that currently face economic problems, political instabilities, and other emergencies and insecurity issues? What are the public health emergencies there that you would like to focus on? Thank you.
Yeah, go ahead, Dr. Fall.
Bom dia, Guiné-Bissau. Obrigado. Merci beaucoup pour cette question extrêmement importante.
Thank you very much for that important question. I've worked with the Sahel. I've worked in Senegal, the northern part of Senegal, which is part of the Sahel. And I was a representative of the WHO in Mali, and I was also the regional director of emergencies, and in 2022 received $9 million for humanitarian response, and that was my main task. So we have 33 million people who need support for health emergencies. We need to ensure that the protection of people is primordial, is key. And we also need to work with local partners in this. I went to Kidal where there was difficult access, and I had teams went to Kidal to provide care to the population. For me, the Sahel is a key priority in terms of access to basic services, the protection of women and children, because 60% of maternal mortality is in crisis areas. When you look at the Horn of Africa, I financed interventions in 2002 up to $5 million. In 2017, I had already put in place the Dakar and Nairobi hubs to give close assistance. But Sahel is one of the key priorities in my program for WHO, my vision for WHO. Thank you.
Okay, then the next member state to ask the question is Malawi. Please go ahead, Malawi.
Good afternoon, good morning. Thank you so
Good
much,
afternoon.
our candidate, for your presentation. A question for Malawi, it's a very simple one. You know, Malawi, like in some other countries in the region, we have really suffered with the impact of climate change. And it has brought with it waterborne diseases, especially cholera. You know, we had our worst cholera outbreak from 2022 to 2023. Our colleagues as well, our neighbors as well, Zambia, they had the same. So my question is, what specific strategies will you put in place to assist Malawi, but also to assist our region in, you know, trying to mitigate the impact of climate change? And how are you going to collaborate with Malawi government as well as our partners? Thank you.
Thank you, Honorable Minister. This is a very important question. And I've really worked a lot on climate change, but also on cholera specifically. If you look at the recent work I've been doing on repositioning neglected tropical disease, you know, under climate change, it's really important to see the risk. And we have done an extensive research to show the risk of expansion of, you know, vector-borne diseases. That's why, for me, what I talked about in terms of integrated disease elimination is important, and we need to take into account the climate change factor. And coming to cholera, in 2017, during the regional committee, 2018, I presented the regional strategy to eliminate cholera outbreak. And we really need to go back to the strategy to see if you have done what you were supposed to do as a region, as WHO, as partner, but as countries. And looking at, you know, the cholera outbreak in Africa, again, in 2022, I did a thorough analysis of the risk from Geneva and shared with the team in AFRO to make sure that we can anticipate what was going to happen. But unfortunately, it's still happening. So I will work very closely with countries like Malawi and all affected countries to make sure that from the public health side and WASH side, we do all the necessary. Let me remind also colleagues that in Africa, access to safe water is a problem. We have 390 million people with no access to safe water. You can imagine that the risk is not only for Southern Africa, but it will go to other countries if you don't do, you know, if you don't take bold action. So working with Malawi, both from the public health side, but also at multi-sectoral level, to make sure that we can have sustainable solutions. Because we have two situations. There are countries where we have new outbreak, but there are countries where we have continuous outbreak of cholera. We need targeted solutions, but also long-term solutions to make sure that the political commitment is there. But as part of the SDGs, we invest in access to water, we invest into sanitation, and we take all the action. As I was saying in my vision, is about health for all and all for health. And this is the only way we can sustain, you know, we can prevent countries from cholera. And in Senegal, in the 90s, when I was working on endemic and epidemic disease control, we were able to also stop cholera transmission. I talked about guinea-worm, and I have strong experience on, you know, preventing and fighting cholera. And this is a high priority for Africa because we cannot think about prosperity and development if we continue having problem to access safe water, if we continue having problem of cholera. And be sure that I will be working very closely with all affected countries, but also non-affected countries in a very proactive way to prevent cholera in Africa. And to end cholera, we shouldn't continue having cholera in Africa. This is a disease we need to end. And when we talk about eliminating disease in Africa, cholera should be a priority across sectors. Thank you.
Thank you. And then the next member state will be Niger. So Niger, you have the floor. Please, Niger, may you please unmute? We'll give Niger another minute, otherwise we'll get the next member state.
Bonjour, Madame la Présidente. Je remercie.
Good morning, Madam Chairperson.
Good morning.
Bonjour. Donc, bonjour, Madame la Présidente. Merci pour la parole. Je
Thank you for
remercie
giving me the floor. I'd like to thank Dr. Fall for his presentation. I'd like to ask him a question on universal health coverage. I would like to find out how you'd ensure that health systems are strengthened and we have more health safety. Thank you, Dr. Adamo, for that question. Your question is very important. We do not have any option. We need to ensure we have universal health coverage by using primary health care. We need to ensure that there's equity and quality service provided. Countries are not at the same level of health development, unfortunately. And I remember at the regional office, we categorized countries based on health risks and the progress made. And you need to look at risks and vulnerabilities of the system and look at the basic functions of public health, including human resources, surveillance, and rapid healthcare to avoid that epidemics becoming pandemics. We need to act fast. In Niger, we invested and we were able to act. We need to look at innovative and sustainable funding, domestic resource mobilization, as well as the rationalization of international finance. I mentioned the Lusaka agenda. We need to look at partners like Gavi and invest on country priorities that are based on national health policies, the national health development plans, as well as other policies. We need to use the available resources more effectively. We need to assist countries to implement universal health coverage and ensure that there's quality service and access by all to the services. Regarding health safety in terms of coordination, surveillance, and scaling up of interventions, we need to ensure that basic services are provided. We should ensure there are no stockouts of vaccines against meningitis, as we witnessed during the COVID-19 pandemic. We need a specific investment in this area. Thank you.
Thank you very much, Dr. Fall. The total time for the interview has been exhausted, and thank you.
Merci beaucoup.
Thank you very much.
Thank you very much, and very good afternoon to you all. We will now have a health break. Where we will conclude the first half of our first session, and we'll reconvene in 30 minutes. We recommend that all members should stay online. Thank you. Enjoy. Thank you. Thank you. I hope you had a short but restful break. We can now resume the live virtual forum for candidates. We will now proceed with our third candidate, Dr. Faustin Engelbert Ndugulile. Thank you, Dr. Faustin, for joining this forum today. May I now ask the Secretariat to ensure that Dr. Faustin is ready to take the floor. Please proceed with your oral presentation of up to 20 minutes.
Honorable Chairman, Honorable Ministers, the Regional Director, WHO-AFRO, ladies and gentlemen, good morning, bonjour, bon dia. Mr. Chairman, I would like to begin by sharing a testimony. Growing up, I had the privilege of living in both rural and urban areas. During my time in these places, I directly witnessed firsthand the tragic occurrences of maternal, newborn, and infant deaths. These images start in my memory. It was during these formative years that I made the decision to pursue a career in medicine with the intention of contributing to saving lives. However, after some time in practice, I realized the limitation of my role as a technocrat in the health sector. So I was primarily focused on treating individuals rather than addressing the underlying systemic issues. To further my ambitions and aspiration, I made the choice to seek public office in order to amplify my voice on national, regional, and global scale. Through my experience as a minister and a member of parliament, I've been able to work towards this objective, and now I'm eager to bring my expertise in technical, policy, and people-centered perspective to WHO-AFRO. Mr. Chairman, thank you for the opportunity to share my background, vision, priorities for the position of WHO Regional Director for Africa. Mr. Chairman, first and foremost, I would like to applaud WHO African Regional Secretariat under leadership of Dr. Moeti for progress made so far towards attainment of health-related SDG targets. We've seen a reduction in maternal and infant mortalities, reduction in cases and deaths related to TB, malaria, and HIV, as well as elimination of some neglected tropical diseases. However, we also now know that we are 6 years away from the 2030 targets. Still, majority of Africa region remains off track in the attainment of some health-related SDG targets. Mr. Chairman, the WHO-AFRO is also facing some threats. Some stakeholders now question the role and the relevance of WHO. They think that WHO needs to renew and reposition if it is to remain relevant. I believe that WHO is still relevant, but we need to be responsive to the needs of member states. We need to be adept at mainstreaming Africa's health agenda at the global stage. We also need to engage with the political and policymakers in the continent, the people who make decisions that impact budget and health services delivered and the health outcomes. Luckily now, this call for renewal and reposition of WHO in Africa comes at a very crucial time as we search for a new leader. I'm of the view that the WHO-AFRO needs a transformational leader with a vision and track record of driving changes, and not a transactional leader who's going to sustain the status quo. Mr. Chairman, I'm that transformational leader the WHO-AFRO needs to drive the push agenda for the attainment of the SDG targets for the health and beyond. I'm fit for purpose for this role with my background as a technocrat, a former deputy minister for health, a former minister for communication and ICT, a politician, and a parliamentarian. I possess policy, technical, and people-centered leadership approach for driving health and well-being agenda. I have years of national and international multicultural experience working at technical levels, providing expert guidance in strengthening health systems in several African countries, including Tanzania, South Africa, Mozambique, Angola, and Rwanda. I also know how it feels to be a minister with the mandate to implement the health manifesto of a sitting government. Ministers, I've worn those shoes before. I know the pressures ministers face and the support they need and expect from the World Health Organization and other stakeholders. In my service as a Deputy Minister for Health, I gained solid experience in implementing policies aimed at reducing health disparities, promoting health equity, and advancing universal health coverage. As a Minister for Communication and ICT, another area that I'm very passionate about, I led a team of multidisciplinary team to champion digital transformation, increase internet coverage, and foster the use of digital technologies to improve health outcomes in Tanzania. My political background and the work as an elected member of parliament has more than equipped me to deliver on the political engagement and the health diplomacy that we need as African continent to steer Africa to a healthy future. I've been a member of parliament, I've been a member of Pan-African Parliament, chair of Parliamentary Committee on Health, vice chair of Interparliamentary Union, advisory group on health. These experiences and in these platforms and so many others demonstrate the power of health and political mainstreaming in the 21st century. My vision is to see Africa region where every individual thrives with optimal health and well-being, supported by accessible, equitable, and a sustainable health system, contributing to a healthier Africa. My mission is to foster the final push for attainment of the health-related SDGs as mandated by the strategic priorities of the 14th WHO General Program of Work and the Africa's Union Health Strategy of 2016 and 2030. My priorities, if elected, I will focus on 4 pillars. 1 will be enabling the right to health. 2, enabling readiness for the next pandemic. Priority number 3 will be enabling health political mainstreaming. And the last one is be enabling responsive WHO Africa region. I'll start with the priority number 1, enabling right to health. Mr. Chairman, I believe that health is a fundamental human right. But looking at the Universal Health Coverage Service Index, most of our countries in the continent are below 50. Moreover, Sub-Saharan Africa contributes 70% of the global maternal mortality, 50% of global under 5 days, and 30% of stunting. Additionally, there's a sharp rise in non-communicable disease, which contributes to over 30% of all mortalities in the region. If elected, I will prioritize solutions aimed at optimizing health promotion and health prevention. I'll also promote access, quality, and affordable health services, enhance maternal and child health services, and also advocate for nutritional intervention. In addition, I will champion functional, climate resilient and sustainable health systems, which are anchored on primary healthcare approach. Furthermore, I will address issues related to shortage of human resources for health, promote community engagement, introduce gender mainstreaming and other gender-related barriers, and address gender-related barriers to health, and also promote the use of technology to advance health and drive down disease burden. I will also promote issues related to sustainable healthcare financing and efficient use of resources at regional, country offices, and among member states. My second priority, Mr. Chairman, will be enabling readiness for the next pandemic. Recent global health emergencies, including COVID-19, have underscored the need for robust pandemic preparedness and response mechanisms. Many lives were lost due to delay in accessing essential vaccine and other health commodities. Again, internet has led to a new epidemic of false information. The explosion of infodemic or misinformation that are damaging confidence in evidence-informed strategies now are undermining uptake of novel vaccines and medicine. Africa imports over 90% of medicines, vaccines, and medical devices, including active pharmaceutical ingredients. Mr. Chairman, as a continent, we need to be better prepared for future health emergencies. If elected, I will prioritize African investments in local manufacturing of health products for priority diseases and other conditions, including vaccine, medicines, and other health commodities. I will foster impactful collaboration with the stakeholders on issues of access to essential commodities and technology transfer. We will develop systems for infodemic containment and optimize Africa pandemic response capacities, including strengthening in-country capacity to prevent, detect, and respond to emerging infectious diseases. We'll also strengthen antimicrobial resistance monitoring and management, and also promote the One Health approach. We'll strengthen the Africa Public Health Emergency Fund to ensure that we have money in case of emergencies. Mr. Chairman, my third priority will be enabling health political mainstreaming. There are concerns of organizational mandates and the competition among regional health players. Member states complain of duplication of roles and the wastage of resources. In order to enhance coherence among health stakeholders in the region, there's need to foster stakeholders' engagement and alignment, as well as support harmonization of roles and evolution of one Africa strategy and leadership for health. If elected, I will work to build robust regional partnership and collaborations, build strong alliances with stakeholders, leveraging expertise and coverage. Mr. Chairman, I'm a firm believer in complementarity rather than competition. My last priority areas will be enabling responsive WHO Africa Regional Office. Mr. Chairman, currently, country support functions of WHO in the Africa region is led by country offices supported by multi-country assignment teams of technical experts who are stationed in 11 capitals in the region. The effectiveness of these teams is affected by limited number of staff and the challenges of skillments. I will prioritize a strong WHO regional office and more supportive WHO country offices to member states. The WHO-AFRO of the future needs to operate with the highest standards of transparency, efficiency, and accountability, placing Africa at the forefront of the global health agenda. There's a need for strong and appropriately tuned African regional office closely engaged with the regional economic communities. As the WHO Regional Director for Africa, I will therefore review the business model of WHO-AFRO Regional Office in order to enhance efficiency, optimal performance, and impact, while assuring that gender equality and geographical equity. I plan to strengthen the WHO country offices, prioritizing the needs and voices of member states, ensuring that the strategies and policies reflected the unique nature of health challenges. By tailoring our approach, we want to provide more effective support to countries and achieve better health outcomes. My commitments to Africa. I'm convinced that the World Health Organization exists to foster solutions for health and well-being for all. I therefore seek the mandate as the WHO Regional Director for Africa to foster solutions for Africa's health and well-being through optimization of available people, processes, and technologies towards attainment of the 2030 health-related SDGs targets in Africa and beyond. I pledge to build on a foundation laid by my predecessors and WHO team to deepen ongoing transformation agenda of WHO in Africa with a focus on responsiveness to the needs of member states and stakeholders. Invest in health, sustainable financing, efficiency, equity, and strategic partnership. My call to action. Honorable ministers, esteemed health stakeholders, and distinguished guests, we stand at a critical juncture in Africa's journey towards achieving health and well-being for all. The decision we make today will shape the future of health in our region, impact millions of lives, and determine our legacy for generations to come. I'm a candidate with vision, experience, and commitment that is uniquely aligned with the needs of our region. My proven track record in public health leadership, innovative approaches to health and the socioeconomic developments, and unwavering dedication to transformative agenda makes me an ideal candidate for the WHO Regional Director post. I invite you to join a movement for the final push to achieve health-related SDGs, a movement that prioritizes universal health coverage, a movement that promotes and protects health, a movement that fosters collaboration across sectors and beyond our country's borders. You have an opportunity to support a leader who understands the complexity of Africa's health challenges and possesses the strategic insight and urgency to turn the challenges into opportunities for growth and development. My sincere commitment to building resilient health system, empowering communities, and ensuring readiness for future health crises is precisely what Africa needs at this pivotal moment. Let us embrace this vision and work together to transform Africa's health landscape. I humbly request your support for my candidature for the position of WHO Regional Director for Africa. With my leadership, we can achieve a shared vision and create a happier and more prosperous future for Africa together. Together, we can drive the change we wish to see. Let us seize this moment, rally behind my candidate, and commit to a future where health is a fundamental right for every individual in our continent. It is time for a strong and more responsive WHO-AFRO. It is time for transformative leadership. It is time for healthier Africa. Thank you very much. Merci beaucoup. Muito obrigado. Asante sana.
Thank you, Dr. Ndugule. We will now continue the interview with questions and answers. I will now pull the first token with the name of a regional committee member which expressed their wish to ask the question to Dr. Ndugule. I shall now give the floor to Malawi to ask the question. Malawi, can you please unmute yourself? Malawi, can you please unmute yourself? The floor to Gambia. Gambia, you have the floor.
Thank you very much. We thank Dr. Faustin for that presentation. Listening to you keenly, we've seen quite a lot of enthusiasm. Now, we have known about the transformation agenda of the current regional director, who took the organization from a very difficult point. We've been observing what she inherited had been very, very difficult. An organization that had structural challenges, performance challenges, and leadership challenges in some cases. Now, that transformation agenda, to the best of my knowledge, has been very, very successful. Of course, we can never have 100%. It's good to get strive for 100%. In your mind, what do you think needs to be improved upon? What do you think needs to be transformed again when it comes to the regional office, WHO regional office? Thank you.
Thank you very much, Dr. Samate, the Minister of Health from the Gambia, for that question. And I would like to applaud Dr. Moetsi and the entire Secretariat for the progress that we have made. Sometimes in health, we don't look on the wellness of a patient by getting out of the hospital. You could have a patient who was unconscious. It was in ICU. Movement to a high dependency unit, that is the progress. And from the high dependency unit going to the ward, that is also progress. And going out of the ward, that is also progress. So there's progress that has been made so far, and I applauded that when I was reading my manifesto. But I think going forward, with the 6 years remaining towards the end of to the end of SDGs, we need now to have the transformation agenda needs to have the political engagement. We need to engage our political leaders. And this, we need to invest in health diplomacy. We need the investments. We need the political will to push the last leg of the mile towards the attainment of the SDGs. And this is a thing that I'm seeing that we need to do going forward. And this is something that I can do because of my background as a technocrat, from the policy background, having been a minister in the health sector and other sectors, having being a member of parliament, over exercising oversight role. I come with a well-rounded background, with that political background to engage at that level in order to push the agenda going forward. Because as I'm saying, we've done so much at the technical level, we are good. Systems are built, now we need to scale up with the political engagement, bring all the leadership in Africa in sync in order to address the, to engage in the last leg of the race.
I shall now give the floor to South Sudan to ask the question.
Yeah, thank you very much, Mr. Chair, for giving South Sudan the floor. And Dr. Faustin, you clearly indicated that you are promising enabling response, our responsive WHO. Africa faces over 100 public health emergencies ranging from man-made and natural disasters to disease outbreaks. In the context of fragile states, this is actually worsened by weak health system and limited fiscal space. Given the opportunity, how would you or how do you plan to address these multiple public health emergencies?
Thank you very much, Dr. Rumunu from South Sudan for that very important question. It's very true what you've said, that we are seeing an increased number of public health emergencies, which are natural and man-made, and it impacts all countries, including the small islands, which are impacted more than the rest. So for me, priorities is to ensure that one, we build climate change resilient systems, and we build robust health systems. We saw during the COVID-19 the disruption that occurred in the health systems, and some countries are still recovering from that, for the sequelae of this disease. But investing in strong, robust, and resilient health system is the way to go. And if I'm elected, I'll work with all countries to make sure that we do that, because it's not good enough working on addressing the after effects of emergencies. We need to be better prepared and better respond in case these health emergencies happen. So one of my priorities would be to push the agenda of doing the assessments, an in-country assessment, develop the national plan, and also develop the surveillance system and build a resilience health system to address the challenges that are related to public health emergencies, but also climate change.
Liberia, you have the floor.
Thank you. My question, can you hear me, please? Am I audible? Yeah.
You're audible, please go ahead.
Okay. My question is related to the issues of emergence of these vaccine-preventable diseases in our sub-region, also in outbreaks of infectious diseases. I would like him to speak on WHO's vision for the development of new vaccines in our sub-region. What is your plan concerning development of new vaccines? Thank you.
Thank you, Madam Minister. Although I didn't quite hear you clearly, but I think I got the gist of what you're trying to say. Your question is, you're asking about how Africa can be better prepared for and build capacity in terms of vaccine production in Africa. We recently released the report WHO and UNICEF has shown that there's stagnation in terms of vaccination coverage, and an increase in number of children with the 0-dose vaccination is also on the rise. So we are having challenges in terms of an increase in cases of measles and other vaccine preventable diseases. But we also saw during COVID-19 outbreak, we had difficulties in accessing vaccines, health commodities, and other health commodities. So in my manifesto, I mentioned that we are over-relying on external sources for our medicines, health commodities, and the medicines. So we need, going forward, as Africa continent, to build up on the already ongoing discussions and the already ongoing initiatives to promote local manufacturing. We need to have local manufacturing of some of these essential commodities within the continent. My vision is to promote regional hubs of local manufacturing. We cannot, all countries, invest in doing local manufacturing at the same time. But we can work together with the African Union and other stakeholders to ensure that we invest in regional hubs of essential commodities so that going forward, some of those important vaccines, medicines, and health commodities that are needed for future emergencies, but also for normal service delivery are available in Africa. And this goes well with other initiatives that are going within the continent to ensure that there's smooth trade between countries in our continent. Thank you, Mr. Chair.
Ethiopia, you have the floor. Ethiopia, please unmute yourself. Ethiopia, you have the floor, please. Mauritania, you have the floor.
Merci beaucoup, Président. Merci, Dr.
Thank
Faustine.
you, Chairperson. Thank you, Dr. Faustine.
Comme vous savez, le 20 mai passé s'est tenu le Forum mondial pour la souveraineté et l'innovation vaccinale.
We need to have vaccine sovereignty so that we have more local production of vaccines.
Se pose le problème de
But
l'acceptabilité de la
then
réticence.
we have the challenge of reluctance to accepting vaccines. And we saw this during COVID-19. And now my question to Dr. Faustine is as follows. How can we overcome this challenge? How can we ensure that we have universal vaccination coverage, given the challenges that we face currently?
Thank you very much, Professor Sheikh, from Mauritania, for that very important question. Yes, as I mentioned earlier in my presentation, we are seeing stagnation in vaccination coverage. And this is a very worrying concern for our continent because some of these diseases are vaccine preventable. But you're also seeing a challenge in terms of vaccine sovereignty in our continent. Because although Africa is one of the largest continents in the world, but we're only contributing to 1.1% of global research. So we need to do more investments in terms of doing research in Africa of new vaccines and new medicines, because we also have a problem with antimicrobial resistance that is ongoing. So we need to do more research on that. But we also faced with the problem of vaccine resistance because of infodemics. But also, again, what the other challenge is that we have weak health systems in certain places, but conflicts are also contributing to the problem that we have currently with the vaccines. So, in order to have that universal coverage and increase the vaccine uptake in our continent, we need the multiple-pronged approach. One, for me, with my background, one is the political will. We need that political will. We need that political engagement. We need to engage the policymakers to ensure that they understand the importance of these things. I've come from a technical background. I've been a minister. I've been a member of parliament. I understand. I know what the people think. I know what the technologists think. I know we as ministers and the policymakers think. We need to make sure that we bring this intersection. People not necessarily refuse vaccines. They need to be informed, they need to be educated, they need to be engaged, they need to see the benefits. But we need to address the challenges that are related to infodemics. This is going to be a major threat going forward for the WHO, and we need to come up with a very clear strategy on how to address this. But lastly, we need to also build the local capacity of vaccines manufacturing, and especially vaccines that are very important for health emergencies. We have learned our lessons. Next time, we need to be better prepared. Thank you, Mr. Chair.
Thank you. Zimbabwe, you have the floor.
Thank you, Rabo. Thank you, Chair. Thank you, Dr. Dikoloti, for the presentation. My question is on emergency preparedness and response. Afro region is vulnerable to natural disasters and diseases and outbreaks. What strategies would you propose to enhance regional disease surveillance and information sharing capabilities? Thank you.
I think, thank you very much for that question from Zimbabwe. And I think it's very pertinent. Issues that are related to global security and sustainable health systems are very important. I think, as I mentioned in my presentation, from the lessons learned from the COVID-19, I'm seeing a purposeful initiative by the Africa to take lead and ensure that we build resilient health systems. But this we can do by working together, because we are seeing now there's a challenge of competition for resources, competition between different entities within African continent. We need to leverage on the strengths of our organization. WHO is very good on the technical issues. They're very good in terms of experiences in addressing health emergencies. We need to properly document these evidences and share with the member states. But we also need to engage the member states themselves. That's why I advocate for a strong regional office and strong country offices. But we work together with other entities that are there available to make sure that Africa CDC has its own strength, it's its own, so that we can leverage the different experiences and work together to ensure that at the highest level of political engagement within the continent, and also make sure that also have the grassroots approach on the ground. So we hope that if I'm elected, we are going to continue building on the existing efforts to make sure that we have very robust and resilient health system with the WHO at the helm of it in collaboration with the other regional players. Thank you very much, Mr. Chair.
Thank you very much, Dr. Faustin. The total time for this interview has been exhausted. Thank you very much, Dr. Faustin, Engelbert, Ndungulile, for being with us today.
Thank you.
We shall now proceed with the interview of the Richard Migo, our fourth candidate. Thank you, Dr. Richard Migo, for joining this interview today. May I ask the Secretariat to ensure that Dr. Migo is ready to take the floor. Please, please proceed with the oral presentation of up to 20 minutes. You now have the floor.
Thank you, Honorable Minister, and I hope you can hear me very well.
Yes, you're audible.
Okay, thank you. So thank you very much, Honorable Minister and Chair of the 73rd Regional Committee for Africa, for the opportunity given to me, but also to my other colleagues who have just concluded their presentation to share our vision and programs during this live virtual forum for candidates ahead of the election of the WHO Regional Director of the African region. I would like also to extend my gratitude to the other Honorable Minister of Health and country delegate who are listening to us today. I want likewise to recognize the presence of Dr. Moeti, the Regional Director of WHO-AFRO, who has done an amazing work for the region in the past 10 years that we need indeed to consolidate and hopefully take to the next level. But also greetings to all my former WHO-AFRO Secretariat colleagues and the large public audience joining us virtually today from the different parts of our continent, and I believe even elsewhere. Honorable Minister, distinguished audience, as our member states are slowly recovering from the consequence of the COVID-19 pandemic and its terrible effects on our national health systems and economies more broadly, I would like to seize this moment to reflect on the journey that has led to my decision to run for the election of the WHO Regional Director of the African region. The reversal of many gains achieved, sometimes very painfully, in the public health sector by our member states in the last 4 years during the battle against COVID-19 reminds me what we went through in my native country, Rwanda, 30 years ago. The history of Rwanda and the history of our continent, particularly during the COVID-19 pandemic, have convinced me on one thing. The African region can ill afford to wait to be saved by others. We must do it for ourselves by uniting our many voices and advocating as one. In 1994, as a young doctor in a rural hospital in the southern part of Rwanda, I saw firsthand how primary health care system, the very foundation of any well-functioning national health system, can be destroyed with devastating consequences for the lives and well-being of our population. The journey we took to rebuild our national health system on solid foundations Okay, thank you. So let me repeat, because I was muted by, I think, the host. I was saying that in 1994, as a young doctor in a rural hospital in the southern part of Rwanda, I saw firsthand how primary healthcare system, the very foundation of any well-functioning national health system, can be destroyed with devastating consequences for the lives and well-being of our population. The journey we took to rebuild our national health system on solid foundations based on equity, fairness, and compassion led to some of the major advancements in the public health sector we are seeing in today. I'm convinced, Honorable Minister, that this past tragic history is not common to Rwanda. And for many of you, this is certainly something that is resonating quite well with your own experience. Throughout my career, I've been entrusted with senior position and major responsibility, demonstrating leadership at national, regional, and global level. I'm committed to leveraging these qualities to advance WHO's mission across Africa. At national level, I contributed significantly to the redesign and revitalization on Rwanda's health system since 1994. I played a key role in launching the Rwanda's National Community Health Care Worker Program, establishing a network of over 55,000 community healthcare workers credited for their contribution for achieving the health-related MDGs in the country. As a district medical director, I contributed significantly in 1999 to the creation of the Rwanda's National Health Insurance System, well known today as Mutuelle de Santé, providing health coverage to almost the entire country, and held several senior positions within the Ministry of Health, including the position of Senior Director of National Immunization Program. Mr. Chair, I joined WHO in 2004, 20 years ago, and provided critical policy guidance to the WHO Regional Office and its member state over my 18-year tenure. As a regional coordinator of the Immunization Vaccine Development Program, I managed several essential portfolios, including a collective battle that we all won, the polio eradication in the region, new vaccines introduction, and as we've heard from some honorable minister, vaccine preventable disease outbreak response and strengthening surveillance system. During the COVID-19 pandemic, I led WHO-AFRO response in this region as the Deputy Incident Manager, coordinating the provision of vital supplies and technical support to our member states. At global level, I led the COVAX initiative delivery efforts within Gavi, the Vaccine Alliance that I joined in 2022, ensuring equitable access to COVID-19 vaccine worldwide. And as a Deputy Global Coordinator of the COVID-19 Vaccine Delivery Partnership, I coordinated the distribution of nearly 2 billion vaccine doses to over 146 countries. More recently, and I was interested to hear the conversation around vaccine manufacturing on the African continent, I also supported the development of the African Vaccine Manufacturing Accelerator, AVMA, a $1 billion Gavi endorsed financial instrument, which is aiming to bolster vaccine manufacturing across Africa. I was very happy to see countries gathering on June 20th in Paris with our colleague from the African Union, Gavi, to celebrate the launch of this historical initiative that will certainly make a difference on our continent. Having worked at these different levels, national, regional, and international level, provide me, Mr. Chair, with a unique perspective on how we can rebuild, strengthen, and consolidate our national health system using sound judgment, innovations, and out of the box thinking to advance some of the most progressive reforms that many of our country need. During the COVID-19 pandemic, and even before that, during other major public health crises that our continent went through, being the H1N1 pandemic in 2008-2009, Ebola outbreak in West Africa, but also in the Eastern DR part, I was at the forefront of the response, both at this regional level here on our continent, but also at the global level, as I said before, having led the ambitious COVAX delivery partnership, as I mentioned. So this long experience, honorable ministers, distinguished audience, taught me one important thing. It is only when we work together and come as a unified voice on this continent that we can collectively and individually achieve major successes. So my decision to seek in the coming days your endorsement for the position of the WHO Regional Director of the African region is rooted deeply in the belief that I can hit the ground running and quickly act, working together with all of you to lead our region in a different and successful path that will see the attainment of the ambitious goal defined by our member states towards the Africa we all want. I think as alluded to by the Honorable Minister of Health from Ethiopia during her intervention previously. So my vision is therefore to enable our region to put health at the heart of its broader development agenda, to ensure healthier and prosperous lives across Africa. I will work with you, Honorable Minister, to create that paradigm shift where health should not continue to be seen as an expenditure only, but rather as an investment for the prosperity of our nations. To achieve this, it will require transforming our national health system into strong, resilient, and adequately financed system to tackle ongoing and emergency threats with the support of a strong secretariat at WHO-AFRO. I have identified 5 priorities in line with the 14th WHO Global Program of Work to address foundational health needs of our region and achieve the vision. So my first priority is to accelerate access to universal health coverage across our African region through strong and resilient primary healthcare system. I think my predecessors have talked about some of the data and statistics, particularly the UHC coverage service index that is very much lagging behind in sub-Saharan Africa. I think according to the latest information we gather in 2020, only 46% in sub-Saharan Africa, we score 46% compared to 68%, which is global average. So there is a lot of work to do in that area. So tailoring universal coverage strategies to the social economic reality of our member states, embedding gender equality in health services, leveraging digital health, and tackling overlooked challenges such as antimicrobial resistance and mental health are quite crucial. By strengthening our national health system and ensuring their financial sustainability, we will ensure that no one is left behind. My second priority stresses the needs to enhance country capacity for prevention, preparedness, and response to acute public health threats. Again, we heard a lot of questions from member states around this particular issue. As we heard, more than 100 public health outbreaks are recorded in our continent on an annual basis. The COVID-19 pandemic, as I mentioned before, has underscored the fragility of our health security. So enhancing our readiness and response capabilities for future crises, requiring reinforcing surveillance system, scaling regional and local manufacturing capacities, and bolstering the training and resources of our health workforce. These steps are essential to build a national health system capable of withstanding future emergencies. My third priority centers on identifying the fight against communicable diseases, catalyzing efforts against the burgeoning tide of non-communicable diseases, and tackling persistently high maternal and neonatal and child mortality. Although we have made some great progress the last 10 years, our region is still lagging behind, as we see that the maternal mortality rate is one of the highest, 531 deaths per 100,000 live birth, as we are only having 6 years to go before the end of the SDG, with the target of reaching at least 70 deaths. So we have a long way to go to address those issues. So addressing these challenges will unlock potential for saving more lives and fostering economic development and societal well-being. My fourth priority, Chair, aims to proactively addressing the key social, economic, and environmental determinant of health, including climate change. I was very much in agreement with some of the questions that were raised by some of the Honorable Minister about the consequence of climate change on our continent. Establishing cross-sectoral partnership, generating evidence for policy coherence across ministries, and promoting health across all policies will ensure a holistic approach to health promotion. Additionally, developing health systems that are resilient to climate shocks will contribute to the well-being of future generations. We would not like to see the devastating cholera outbreak that we've seen in sub-Saharan, southern part of the region. And I would like here to echo the comment that was made by the Honorable Minister of Malawi on how we can work to avoid such crisis in the future. And if the opportunity permits, I may come up with some additional thought on that. Lastly, I wish to lead an effective, well-resourced WHO-AFRO Secretariat that is responsible and accountable to member states. I've spent close to 20 years working for WHO, and I know how important it is to have a more responsive and accountable secretariat, not only at the regional level, but more importantly, at country level. We need to change that pyramid to make sure that our focus is really going to go to the country so that we can respond better to the needs of our member state. So this strategic priority for me is crucial for the success of other strategic priorities. By increasing operational efficiency, ensuring budget sustainability, and focusing on enhanced responsiveness and accountability, we can effectively support our ambitious agenda. Honorable Minister, distinguished audience, the successful implementation of these 5 priorities will be enabled by additional action indeed. Number 1, I will try to make sure that we are strengthening existing partnerships and forging new ones, including not only the bilateral and multilateral organization, but also the African Union institution. I will make sure that we're establishing robust working relation with Africa CDC, hopefully sooner the African Medicine Agency, NEPAD, and other African Union institutions. Number 2, by adopting evidence-based and data-driven approaches and systematically, and I think that is something we've run short of it, measuring the impact of our action and taking corrective action. And then 3rd, ultimately supporting countries to identify, locally adapt, and put at scale proven health innovation. Honorable ministers, distinguished audience, I'm fully committed, if I got the chance to be elected as the next regional director of WHO in the African region, to dedicating my expertise, my skills, my energy, and my passion to support you and our member states, and to position WHO-AFRO as a leading office in this pivotal moment. As we navigate together the multiple health challenges our region is facing today, we have a unique opportunity to transform our health system into engines of development. This is the paradigm shift I'm proposing to put forward, and I strongly believe that Africa deserves it. Together, we can seize this moment to create a healthier, safer, and more resilient Africa. I thank you, and Mr. Chair, and I submit.
Thank you very much, Dr. Migo. We will now continue the interview with questions and answers. I will now pull the first token in the name of a member state which expressed their wish to ask a question to Dr. Migo. Malawi, you have the floor.
Thank you so much, Chairperson, and thank you so much, our candidate, for the presentation. I listened, but I might have missed it. Your strategies on One Health. I know most of us member states in the Afro region, we are way behind. We have not yet fully incorporated the principle of One Health. So what are your views and what are your strategies to make sure that the member states in the Afro region, they embrace the spirit or the principle of One Health? Thank you.
Thank you, Honorable Minister. I think this is a very important point you have raised. As I said before, our region is really affected by many public health outbreaks annually. And according to the data that WHO has published, close to 75% of these outbreaks are of a zoonotic nature. So promoting a One Health approach is not a luxury, it's an imperative if we need really to tackle quite comprehensively the disease outbreak that we are facing on our continent. So I've taken a very clear stance in my program to make sure that as part of the strategy that we're going to put forward in our prevention, preparedness, and response capabilities on the region, One Health is at the center of our positioning when it comes to response to the outbreak. We will definitely forge partnership with other ministry, including agriculture, fishery, and others, to make sure that we are not only having a health-centric approach to our response, but maybe having more holistic and One Health approach to when it comes to response to our emergency. Thank you.
Thank you. Ethiopia, you have the floor.
Thank you very much. Thank you, Dr. Richard. It's a pleasure to hear from you and your vision for Afro, let you become an RD. And it is a pleasure to hear your entire vision in general. My question is for sustainability. How do you envision a sustainable Afro and a regional office where countries can also be enabled to work on emergency-related issues? Thank you.
Thank you, Honorable Minister, for this question. I mean, you have raised a very fundamental point when it comes to sustainability of our action. First of all, I'm a strong believer that WHO-AFRO or WHO in general is there to help and to support member states. So the sustainability of our action is linked to the fact that we need absolutely first and foremost to support, to put in place the right policy, the right strategy to make sure that countries can and should be able to perform at a level that's very acceptable to tackle their own challenges. So the role of WHO should and must to make sure that we are facilitating that process, to make sure that countries are strong enough. And one could say even we need to have a vision on where our even presence should be decreasing as the country capacity is increasing, tackling their own system. And when it comes to supporting emergency, I think it's critical because I've put this as one of my the second priority of my program, because what we went through during the COVID-19 pandemic clearly shows us that most of our countries did not put in place the right strategy or the right program in place to anticipate some of these issues. In 2008, 2009, when the first, I can say in this 20th century pandemic hit, the H1N1, I was tasked to develop the first ever, actually, pandemic response strategy for the African region to respond against the H1N1 came through the Ebola outbreak in many parts of West Africa. And then more recently with COVID-19. So what we've learned is it looks like history is repeating itself, and we are not taking the right strategy to make sure that we are ahead of the curve to anticipate some of the issues. This is what I want to change. This is what I want to work with the country to make sure that our preparedness and capabilities are heightened, and make sure that when because it will happen, public health event will come in the future, our system are strongly enough to respond adequately to those threats.
Thank you. Guinea, you have the floor to ask a question. Guinea, please unmute yourself. Guinea, please unmute yourself.
Oui, bonjour à tous.
Good afternoon to all. Good afternoon and congratulations, Dr. Richard, for your brilliant presentation. Guinea has the pleasure to ask you this question. And since we're a country that we are faced with the recurrent epidemics, and since you have a lot of experience in responding to these epidemics, we want to rely on the technical and financial support of WHO as the leader in this strategy, in this endeavor. What strategy do you envisage putting into place and to increase the capacity building in the ministers and all the stakeholders involved in fighting against the diseases? We are especially interested by the specific initiatives that you have envisaged for improving coordination, training, and the deployment of resources in an epidemic context. Thank you very much, and we thank you in advance for your answer. Thank you. Madam Secretary General at the Ministry of Health, I believe you have touched upon a crucial item. As I said a few minutes ago, one of my priorities really for this mandate, if I were to be elected as Director General, is to try and turn upside down this pyramid where most of the resources are concentrated at the regional office, even at headquarters. And we have seen together with Dr. Moti, who had embarked upon changing into this situation and bringing the resources towards the countries. For me, it is a major priority in order to give our country officers the capacity, the resources, and the necessary wherewithal to support our member states, because the presence of WHO is only there for a good reason if we can be at the service of our member states. Secondly, you mentioned another important item. How can we do capacity building within the Ministry of Health? I believe that this is a very important detail. WHO as being at the head of the technical partners at health level should set itself this primordial objective, namely to transfer the skills and knowledge as one of its major priorities. We cannot and we must not develop our country officers only to the expense of the capacity that should be transferred to the Ministry of Health. And in fact, the success of WHO should measure itself by its capacity in the capacity building of the ministries of health in order to respond to the essential health issues that arise in the countries. I can reassure you this is one of my major priorities. With regard to the improvement of training, I have included in my program a very important chapter, namely capacity building. We're going to work with the WHO Academy. We're going to work and diversify with the national institutions, first of all, start off with the capacities that we have within each country, strengthen them so that these same institutions, whether we are referring to the academic institutions or vocational training institutes, strengthen them not only logistically but financially so that they in turn can give the necessary support to the Ministry of Health. And finally, as far as emergencies are concerned, we are going to work in such a way to make sure that the Ministries of Health are in a good position and equipped to face all this. Thank you. Thank you, Dr. Richard.
Thank you. Eritrea, you have the floor. Eritrea, please unmute yourself. Eritrea, unmute yourself, please. Togo, you have the floor.
Merci.
Thank you.
Merci beaucoup, Monsieur le.
Thank you very much, Mr. Chairman. Good afternoon to all. We followed most attentively the program presented by Dr. Richard, and we have one question to ask. How are you going to organize this strategy to limit to stop human resources from leaving the region if you were to be elected as the regional director? Thank you very much, Dr. Dogby. I think you have touched upon a very sensitive issue with regard to our health systems, generally speaking. Very often, and rightly so, we fear this brain drain at the African continent level, people leaving towards the Western world. But we also note by the same token that there is a brain drain from the national structures towards international organizations, including WHO. And I believe that we cannot, derobe St. Paul to robe St. Peter. Now, I am extremely sensitive on this item, namely to do capacity building at the national level initially. My strategy is going to focus on three sections. The first one, as I said already, and in answer to the question that was put to me by the lady from Guinea, is to do capacity building, first of all, at the national level, launch a critical mass training program in order to strengthen the staff working in the health sector. And then secondly, to have an ongoing training center within the national health centers. So that the health professionals who work at the national level can find the necessary motivation to initially remain in the system, serve their country, and then go forward and advance. And then thirdly, in the concern to strengthen the country offices, which remain a priority for my program, and moreover, which is a priority for most of the countries with whom I have been in touch when developing my agenda for the next 5 years to come, it is quite clear that we must not favor just a situation where we're going to deprive the ministers of health of capital resources. Therefore, I undertake, Dr. Dogbe, to work with the member states to make sure that we strengthen their national capacities so that they not only have the necessary number and above all, and this is the most important, the necessary quality of staff at all levels, whether national and especially at the decentralized level, so they can serve, first of all, their people. The country offices and international organizations then can come with additional expertise and additional support to strengthen the national structure, but I will be the spokesperson and do all the necessary advocacy so that we do not deprive the national stakeholders of their skills that they have so dearly acquired.
Thank you. Liberia, you have the floor. Liberia, please unmute yourself. Liberia, you have the floor. South Sudan, you have the floor.
Thank you very much for giving South Sudan the floor. Guinea and Eritrea has basically taken my question, but I want to still ask this question in relation to the recently launched African Health Workforce Charter in Windhoek earlier this year. How do you plan to domesticate the charter in member states using affirmative action in building resilience in fragile states in the spirit of leaving no one behind? Thank you.
Thank you, Dr. Munu. I think the health workforce crisis in our continent, it's really a major one. And I applaud actually this quite a very important initiative that was taken and launched more recently on the African Health Workforce Charter. I think to reflect what I was saying before from Guinea, but also as well Togo, a question. And again, across many conversations I've had with Minister of Health, my own experience on the ground, visiting health facilities, I think this is a real problem that our region is facing. I believe that we should take several steps and many actions on that. While the formal, let's say, training of professionals may take time, I think we need absolutely to embark on that, put the right policy in place, the right investment to make sure that the formal education for our health professionals is supported, sustained, particularly in countries where we have conflicts and where we have really a crisis. The case of South Sudan and in many other places. But secondly, we need to find alternative. And there is a solution that we have experienced, and I have quite very first-hand experience with that, what we went through in Rwanda after the tragic event we went through in 1994. So we need to find alternative to to come up with buffer mechanism that can help while we are developing a more formal education system to make sure that we have community healthcare workers, for instance, that can help to carry out some of these basic things. So I will support very much the African Union, Africa CDC initiative that WHO as well has contributed to the promotion of 2 million community healthcare workers on the African continent. I will dedicate time, I will dedicate the resources to make sure that this is a successful initiative that can help to advance things. And we have success stories in many countries where the community healthcare workers have created, in terms of task shifting, the differences on the ground when it comes to delivering on some of the basic package of services to remote area, etc. And then finally, in terms of affirmative action, I think we need absolutely to make sure that the human resource for health is part and parcel of any national health strategy that are going to be supported by WHO coming forward. And I will take this as a priority in my action to make sure that this area is prioritized while we are finding alternative solution to respond to this health worker crisis that we are facing on our continent.
Thank you. The total time for this interview has been exhausted. Thank you very much, Dr. Richard Migo, for being with us today.
Thank you, Honorable Minister. It was my honor and my pleasure. Thank you.
This concludes the live forum for candidates for the WHO Regional Director for Africa. I would like to thank all member states of the WHO Africa region and the candidates for having joined this forum today. We had a rich exchange, which will be valuable to member states in their assessment. I wish you all a good day and look forward to seeing you in person in Brazzaville for the 74th session of the Regional Committee. Thank you very much. Ula.
Great, thank you. Thank you so much.
Pula. C'est la bénédiction du chef. La carte que j'ai là. Ça me suffit. Merci. Bonne journée. Merci beaucoup. On est ensemble.
Thank you, Chair.
Pula.
My brother.
Thank you very much.
Thank you, Pula.
Thank you very much. Yeah. Thank you very much.
Thank you.
Merci. C'est bon?
Oula. Merci beaucoup. Thank you.
Pula, Pula, thank you very much.
Merci pour tout le monde. يقول لك 3-0 لا صحيح